let's start with our new chapter, that is respiratory system. In respiratory system, you have two topics which you should learn. One is COPD, that is chronic obstructive pulmonary disease. The other is asthma. Okay. Normally what we call cold. Okay, that is actually chronic obstructive lung disease. That is why it is called cold. Okay, it has a full form to it, chronic obstructive lung disease. So chronic obstructive pulmonary disease, these are a group of diseases. Many diseases are included in COPD. Okay, there are there is chronic bronchitis, bronchiolitis, bronchiectasis, emphysema. All these are included in COPD. Sometimes COPD can be interrelated with asthma. They can coexist. Okay. So what is COPD? Chronic obstructive pulmonary disease. What disease is it? Pulmonary disease. Pulmonary is lungs, that we have understood. Chronic. Okay. This increases over time. It doesn't develop suddenly. Asthma attacks can be sudden, but COPD, that is the difference. COPD, it is a chronic condition. Okay. And it is obstructive disease. What happens to the airway? First we breathe through our nose. Then we have our pharynx, trachea, bronchi. It divides into right bronchus and left bronchus, the main bronchus. That divides into primary bronchus, secondary bronchus. It divides into again bronchioles. Finally they have terminal bronchioles. It is said that it divides about 17 times. Okay, from the main bronchus, right and left, then again secondary, tertiary, finally till it goes to the terminal bronchioles. Okay, finally terminal bronchioles, it divides about 17 times. Then those terminal bronchioles, they open into the alveoli. Okay, what are alveoli? Those are air filled sacs. Alveoli is plural, alveolus is singular. Okay, it is also called as acinus or acini. Fine. So these are a air filled sac where exchange of oxygen and carbon dioxide takes place. In the alveoli, there comes the blood vessels. From the alveoli, these blood vessels, they take the oxygen. Okay, that is how the deoxygenated blood is converted to oxygenated blood in the lungs. Fine. Now, this COPD, that is chronic obstructive disease, right? So, it obstructs anywhere. If it obstructs in the bronchi, the main bronchus, if it obstructs, what is it called? It is called chronic bronchitis. If it obstructs in the bronchioles, it is called chronic bronchiolitis. Okay. Then you have emphysema. In emphysema, there is dilatation of the bronchioles and dilatation of the alveoli. They lose elasticity. So that is what happens in emphysema. So now we will see that how a normal alveoli, when it is inflamed, can produce more there is more mucus secretion and there is mucus plugging there because of that inflammation, and also there is obstruction to the airway. So this is chronic obstructive pulmonary disease. First I will draw here the normal. Okay, start it from here. This is your nose, you breathe it from here, the air goes inside. This is your pharynx, then trachea, then comes the main bronchus, which divides into right and left bronchus. Okay, we usually draw it like this. Okay, right and left bronchus entering the lung, but after it is divided into bronchus, from main bronchus, when it divides into right and left, it further divides again. Okay, now after this further division, again it divides. Okay, it keeps dividing till 17 times. After all that, then finally comes your alveolar sac after terminal bronchioles. Okay, so this is your normal lung. Fine. Now, in COPD, what happens in COPD? First, suppose this is your normal alveoli. Okay. So this is your normal alveoli. Suppose there is any damage. Suppose there is any damage to the alveoli. So here there is damage to the alveoli. What happens to the alveoli if it is damaged? It compensate. It is increased in size now. This was the injury here. So now it has inflamed and got larger in size. Inflammation and increase in size. Because of that, there will be breathing difficulty. So that breathing difficulty, it also causes inflammation in bronchi and bronchioles. Okay, look here in this diagram. Suppose here patient had any damage in the alveoli. So this inflammation, it will spread to the bronchioles, then ultimately it will spread to the right and left main bronchus also. So now that will spread to the bronchus. This is normal bronchus. Just label it here. This is alveolus and this is bronchus. Now in the bronchus, this is the lining of the bronchus. So now inflammation, when it spreads to the bronchi, they are inflamed. Because of this inflammation, there is mucus plugging inside. It is narrowed. Can you see the lumen? Here the lumen is more, whereas here the lumen is less. Now here, because of that, the cilia what we had here, the fine cilia here, this cilia present here on the bronchial wall, that cilia is damaged cilia, and there is mucus plugging. I'll explain each one of them. Why is there mucus plugging and why is the bronchi irritated, inflamed? Okay, now irritated airway. So all these things happened because of what? Because of damage to the alveolus. Okay, that is how it has spread here. Now because of the obstruction, okay, this was the bronchi, there is obstruction. Because of the obstruction, there is resistance to the airflow, and this resistance, it is irreversible. It will lead to irreversible damage, unlike asthma which can be reversible. In COPD, this is irreversible. Once the damage has occurred, it remains for lifetime. So there is air resistance in COPD. Now, what happens in COPD because of air resistance? Suppose it is emphysema. So normally these alveoli, they have stretching capacity. They are very elastic, just like this balloon. Okay. Now suppose this is a alveoli. So air comes into the alveoli, it receives oxygen and it gives out carbon dioxide. Just how we breathe, this alveoli, they are very stretchable and they can easily pass the oxygen and carbon dioxide. Okay, this is how the alveoli works. This is just a air filled sac, just like an alveoli. Okay, what happens in emphysema, in COPD? Okay, in emphysema, suppose this elasticity is lost. Okay, the elasticity of the alveoli is lost and they are always swollen, normal size of the alveoli. Okay, now these are always swollen, these are like this. Okay, in semi swollen state. Now what happens, they are not elastic enough, they won't swell enough or they won't even shrink. I can't press it properly. Okay, because it is hard now, it has lost the elasticity, whereas this thing, it had lot of elasticity. This is normal alveoli. Okay, see, it can contract and relax easily, but this damaged alveoli, it is swollen, semi swollen, and I cannot press it properly. So now this is damaged. Because of that damage, now it is always in semi swollen state, and if there is no proper shrinkage, then can it pump out the oxygen outside? Can it pump out the air outside? No, it cannot do that. So there always remains air inside. So if there is air already inside, then the amount of air what we inhale, will it go into the alveoli? No, it won't go, because they are already swollen and there is air present inside. So there is decreased oxygen in these patients. If there is decreased oxygen, then carbon dioxide level will increase. Let me tell you, During COVID especially, everyone were using pulse oximeters. Okay, everyone had pulse oximeters. They were used to attach it in their home, and they used to always check if they are desaturating, if their oxygen level is going down. What is the normal level of oxygen in normal people? It is 97 to 100. Till 94 it is acceptable. Okay, so below 94 there should be a problem. Above 94 it is okay, well and good. Almost everyone will have above 97%. People in COPD, they'll have oxygen saturation of only 88 to 92%, and that is fine for them. You need not administer oxygen. Okay, if they are having oxygen saturation between 88 to 92, then that is well and good, that is fine. No need to give them oxygen. Even if you give them oxygen, that oxygen won't reach the body. Their body is habituated for less oxygen. If you administer more oxygen to them, then that oxygen, it will be converted to more carbon dioxide, and that will be dangerous for the patient. So always maintain a saturation between 88 to 92 for COPD and asthma patients. Okay, so now this was about emphysema. So what happens in patients COPD? So in patients suffering from COPD, there is lack of nutrition. Okay, what they eat, it is not absorbed properly. They get weak. They are very lean. Think about a COPD patient. See, COPD patients, mostly COPD is also again associated with risk factor of smoking. Almost all respiratory, just like how you have written in CVS that hypertension, hyperlipidemia, diabetes, all these things, smoking, all these things will cause serious disorders. Similarly, almost all respiratory conditions, they are aggravated by smoking. Smoking is always a risk factor. So now, if a COPD patient, if a person smokes cigarette, then that may lead him to COPD. Okay, imagine a poor patient. Okay, poor. His build is poor. He is very lean. He always smokes BD. Can you think of any people like that? Especially laborers. Okay, these laborers, they always have the habit of smoking BD. How are they? They are very lean. You can see all the ribs. You can count their ribs. That's how lean they are. That is because of COPD. Most of them are suffering from COPD, and they also have lack of nutrition. And muscle, their skeletal muscle, they also undergo hypertrophy or atrophy. Okay, they also undergo atrophy. They that skeletal muscle, it loses its mass, and there is also complete weight loss of the body. All these things are seen in COPD.